If you've only just joined us, we're getting to the end of the show. You're watching the Daily Roundup with Nina. It's now time for our health. Now, anesthesia is a medical treatment that's administered into the human body during medical procedures or surgery to prevent major pain. There are various forms of anesthesia used, some to only numb certain parts of the body, while others can be used to numb the brain to induce sleep for more invasive surgical procedures. As to give us more details on this, I'm joined this evening by Dr. Rodney Lichtman, an anesthetist. Good evening and welcome, Doctor.
Thank you very much.
Thank you for being here. Talk to us about the importance on the use of anesthesia, especially for medical procedures.
Well, most procedures, operations and things like that require some degree of sleep, some relief of pain, and possibly also to relax muscles so that the surgeon can get access to where he's working.
Yeah.
Now you mentioned they get different types of anesthesia, and we would really talk about general anesthesia where the person's put to sleep, so they're unaware of what's going on. There's no pain at all, so they don't have high blood pressures, and their muscles have been paralyzed and relaxed. Then you can get, for example, for a cesarean section where you inject local anesthetic into the spine and the patient is pain-free, but they're fully awake and aware of what's going on.
Right.
And that's called regional anesthesia. You could also have local anesthesia. If you cut your finger, we can just inject a bit of local around there. So there's different levels of anesthesia.
And can it be administered to anybody, or there's cases where certain people cannot be given any anesthetics, even if they have to undergo a medical procedure?
Well, we grade risks for anesthesia. So there's a grading system based on your other medical problems that you might have, your weight, your age, and things like that. So you get grades 1 to 5. In grades 1 and 2, the anesthetic shouldn't be risky, and it can be administered by a general practitioner who's trained in that. The higher grades, different. We talk about there's certain situations where the patient is too sick for anesthesia, but there's also patients where the patient's too sick not to be having an anesthetic. So if they rupture, they have an aneurysm or something like that, regardless of the risks, you've got to go in there and do that, otherwise they will not make it.
All right. The anesthesia obviously can also have side effects. Talk to us about that.
Well, there's minor side effects and there's major ones.
Right.
So commonly people are nauseous when they wake up from an anesthetic. This is often due to the drugs we use, and the morphine type drugs can cause nausea. People can be restless afterwards. It depends on some people. So there's a lot of minor things. They can have pain where the drip has been put in, itching, things like that. And then you get major side effects, which we obviously want to try and avoid. And the worst major side effect is if a person has had brain damage from a very low blood pressure, or some situation like permanently paralyzed. These are the sort of major things which does occasionally happen.
Yeah. Doctor, we've also seen incidences where people would wake up even though they've had, for example, a general anesthetic administered to them, for surgery. Why does this happen, and is it common?
Well, I'll tell you a joke. We sometimes say anesthesia is the half asleep administering to the half awake. Okay. I hope that is not always true. You do have an incidence. The incidence is 1 in 1,000 patients can have a degree of awareness during anesthesia. Sometimes just like a few unpleasant memories or something like that. It can happen. And it can be due to technical failures of the equipment, or it could be due to a failure of the anaesthetist administering it. So it does happen. Usually there might be some awareness. Hopefully there's no severe pain and other anxiety related to that.
Doctors are also very keen on having patients being calm and in a state of almost tranquility before they put them under. Why is that important? And also, how can patients prepare themselves before having to go under anesthetic before a medical procedure?
Okay, the calmness before the anesthetic, we call it a pre-med, where they're given an injection or a tablet just to calm them down. And it's probably not used as much as it should be, because a lot of patients in the settings that we have in this country are not admitted the night before, and they can't be these drugs can't be prescribed then.
Right.
Okay. If you're a patient now and you're going to have an anesthetic, how can you prepare for it? It depends on how much time you've got. Let's say you're having a hip replacement and it's scheduled for 2 months' time. You know, you can lose weight, stop smoking,
Right.
get yourself into slightly better physical shape. Sometimes it happens immediately. Suddenly you've got a problem, and in 2 days' time you've got to have an anesthetic. Okay, so well, you prepare yourself mentally. You've got to trust the people doing the anesthetic and the doctors doing that.
Yeah. Dr. Lichtman, that's all the time and questions I have for you this evening, but thank you so much for being here tonight.
Okay, and I hope I never meet you professionally.
Why is that?
I wouldn't want to give you an anesthetic unnecessarily.
Thank you, doctor. Thank you for your time.
Okay.
That was Dr. Lichtman speaking to us. We'll be right back after the short break.